Hello everyone, welcome in today's nursing webinar quiz session. As you all know, every month, 4th or 5th Thursday, we play the quiz on the previous dealt topics for that particular specialty. So I encourage everyone to share the link and game pin number to have more participations and knowledge disseminations for all. So having said so, let me welcome the quizzer, who is none other, the Miss Rosaline, who is our senior nurse educator from Nursing Education and Academic Department, who is going to drive us through this session. I welcome you, Rosaline, and you can take the session over. Unmute yourself.
Okay. Hello, everybody. Thank you very much, Shanti ma'am, for the great introduction. I am thrilled at the participants joining. We have them joining in great numbers. That's a pretty overwhelming response. Okay, from those who have joined, let me read out a few names. We have Megha, Maha, Saumya, Merlin, Swapna, Hannah, Tulasi, Pavitra, Pramila, Baby, and we are expecting more of you to join us. I'm super excited to take you through the quiz, and I'm sure you are equally excited to play this. Yes? Okay. To remind you of the game pin, it is displayed on the top. It is 8585342. I repeat, 8585342. Okay. Let's begin. The Nursing Pro Quiz, which is on medical and general nursing. This is the 10th Nursing Pro Quiz that we are playing today. Okay. Before we start, let me share you a few secrets to win the game. Number one is eliminate the wrong answers first. That would make your job easier. Select the right options. Check for multi-selects and double points, which is very important. And to top it all, most vital is fastest finger first. You just don't have to answer it right. You also have to be the first one or be quick in answering. Okay, so we have 3 rounds for the day. The first round has dengue fever overview and preventive measures. The second round would include how self-concept impacts communication. Round 3, viral pneumonia and its management. Okay, let us begin with the first round, that is about dengue fever overview and preventive measures. Ready? The first question is, how does dengue spread? Let me tell you the options. Option A, the Plasmodium parasite. Option B, female Aedes aegypti mosquito. Option C, female Anopheles mosquito. Option D, male Culex mosquito. We already have 55 members who answered the question. And let me tell you, people joining us on Facebook Live, you can also answer in the comments section. 3 seconds left, 2, 1, we done. 25 of you have answered this right. Yes, option B, female Aedes aegypti mosquito. Let's see who's on the top. SSV is on the top. Second is Elizabeth. Swami on 3rd place. Rani is on the 4th place. And Ebina is in the 5th place. Great going, guys. Let's see the rationale. Dengue viruses are spread to people through the bite of an infected Aedes species. To be more precise, Aedes aegypti mosquito. Ready for the second question? How is dengue fever diagnosed? Option A, blood culture. Option B, clinical symptoms only. Option C, urine test. Option D, dengue serology. How is dengue virus diagnosed? You have 14 seconds more to answer. We already have 66 who answered it. Okay, 72. Only 3 seconds left. Make it fast. Done. We have 62, wow, who answered it right. Yes, it is D, dengue serology. Okay, we have Swami now on the top, Rani in the 2nd place, MS on the 3rd place. Let's see the rationale. As the immune system fights the infection, the IgM antibodies against dengue virus are detected 4 to 5 days after onset of symptoms. So when you get an IgM positive result, it tells you that the person had a recent dengue infection. Question number 3, which of the following is a symptom of dengue? Let me share the options. Option A, fever and rash. Option B, periorbital pain and intense headache. Option C would be muscle and joint pain. Or is it option D, all of the above? I repeat, fever and rash, periorbital pain and intense headache. C, muscle and joint pain. D, all of the above. You guys are very quick in answering. I already have 79 people answered. Okay, 44 of you have answered it right. The option is all of the above. Let's see who's on the top now. SSV has come on the top. Swami has gone to the second place. Rani is still there in the first 3. Okay, the rationale behind the question is fever, rash, periorbital pain, intense headache, joint pains. All of these are the classical clinical features of dengue. So the answer is all of the above. The fourth question, please remember, it has double points. The question is dengue fever is also known as option A, jungle fever, option B, enteric fever, option C, breakbone fever, or option D, Zika fever. Dengue fever is also known as what? Okay, you have 13 seconds left. We already have 79 people answering the question. That's pretty fast. What is dengue fever also known as? 2 seconds, 1. Time's up, guys. We have 46 people who answered it right. It's breakbone fever. Okay, let's see the tall Swamis again on the top. Megha has reached to the second place. Swarupa on the third place. S. Das and Elizabeth are in the top 5. Wonderful. So the option is option C, breakbone fever. Endotoxins are released, leading to inflammation of bones, joints, and muscles, causing severe pain and muscle spasms. It is also known as dandy fever or 7-day fever because of the usual duration of symptoms, that is for 7 days. The symptoms usually last for 7 days. Okay, so next we are done with the round 1 and we are proceeding to round 2. This is all about how self-concept impacts communication. The next question, what do you understand by self-concept, or what is self-concept? Option A stands for individual's perception of self. B, role performance. Option C, discredit. Or option D, self-centeredness. What is self-concept? Is it individual's perception of self, or the role performance, discredit, or self-centeredness? We have 67 people answering already. You have just 3, 2, 1 second left. Time's up. Wonderful. We have 70 people who answered it right. Good job. Swarupa has reached the first place. Megha is in the second place. Elizabeth on the third place. Okay, let's see the rationale. Self-concept is nothing but a collection of beliefs one holds about oneself and responses of others. So it is all about how we see us. The next question is, what happens when one has a low self-concept? Option A, negative feelings. Option B, anxiety, anger, guilt. Option C, constant self-criticism. Or is it option D, lack of confidence? Or is it all of the above? You have 10 more seconds to answer this question. What happens when one has a low self-concept? My God, we have 92 people who have answered it, among which 84 of you have answered it right. Okay, Swarupa still leading. She's on the top. Megha in the second place. S. Das is in the third place. Okay, it's all of the above. When a person has low self-concept, they usually present with symptoms like anxiety, powerlessness, low self-worth, fear of rejection, or very, very low self-confidence. Next question is a multi-select question. Please remember you have more than one correct option. That is, you have two correct options. Why is self-concept important in nursing? Option A, more accountable for their patients. Option B, patient feels more respected. Option C, influences evidence-based practices. Or is it option D, freedom of work? You have two correct options. Guys, you have to select two correct options. Why is self-concept important in nursing? Okay. We have 39 and 45 people who have answered it right. There are two correct options. Swami has reached the top. Swarupa is in the second place. PC has moved all the way along to reach the third place. Good job. Okay, so let's see the rationale. The correct options are A and C. Nurses with high professional self-concept are more accountable for their patients. It is also worth mentioning that high professional self-concept positively influences the acceptance and demand for evidence-based practice in nursing. So we have two correct options. Next is a true or false question, and this has double points. Does low self-concept affect communication? Is it true or false? You have double points. Please mark it. Does low self-concept affect communication? Is it true or false? Very good. We have 90 people answering. 14 seconds left. I repeat, people watching us live on Facebook also can answer the questions by typing it in the comments section. 3, 2, done. Okay, we have 89 people answered it right. Good. Next, Swami on the top, PC in the second place, while S. Das has reached the third place. We still have a few more questions, so keep going. The rationale is a person with low self-esteem might project their insecurities onto others, causing negative interpersonal interactions and poor communication. So yes, it is true that self-esteem, low self-concept definitely has an impact on communication. So we are done with 2 rounds. We are proceeding to round 3, which we will be discussing, or which we will be dealing about viral pneumonia and its management. So the next question, what is pneumonia? Let me show you the options. Is it option A, inflammation of air sacs or alveoli? B, inflammation of bronchi? C, inflammation of pleura? Or is it D, inflammation of the lung parenchyma? We have just 2 seconds left. 1, done. Okay, we have only 14 people who have actually answered it right. It is inflammation of air sacs or alveoli. Let's see the scoreboard. PC is on the top. Swami in the second place. MS in the third place. Okay.
By the way, Rosalind, who is this PC?
We will try finding out that, ma'am. Okay. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill up with fluid or pus. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. So it is the inflammation of air sacs or alveoli. Next question. Which groups are more prone to viral pneumonia? Option A, infants and younger children. Option B, people greater than 65 years of age. Option C, patients on chemotherapy. Option D, post-organ transplant. Or is it option D, E, all of the above? Quicker, 2 seconds. 1. Very good. Pretty fast. Okay, we have 70 people who answered it right. The correct option is all of the above. Okay, let's see the scoreboard. PC still on the top, Swami in the second place, and Laka is in the 3rd place. We have S. Das and Mega also sharing the 4th and 5th places. Okay, the rational is infants, younger children, post-organ transplant people, elderly, immunosuppressive patients are all more susceptible to viral pneumonia. They all come under the high-risk category. Okay, next is a multi-select question. You have 2 correct options. How to prevent viral pneumonia? The question is how to prevent viral pneumonia. Let's see the options. Option A, vaccination and healthy lifestyle. Option B, use immunosuppressants. Option C, hand washing practices and personal protective equipment. Or is it D, exposure to people who are ill? It's a multi-select question. You have 2 correct options. You have to select 2 options, A, B, C, and D. We have 65 people who already answered it, 77. Okay, we have 77 and 70 who answered it right. Let's see. PC is still on the top, Swami in the 2nd place, Laka on the 3rd, Swarupa is in the 4th place, SSV in the 5th place. Okay. So the rationale is vaccines can prevent some types of pneumonia. Good hygiene, quitting smoking, and keeping your immune system strong by getting regular physical activity and eating healthy are other ways to lower the risk of getting pneumonia. Okay, so all of these can prevent pneumonia. The last question for the day. It has double points. What are the most serious complications of viral pneumonia? Most serious. Option A, ARDS, acute respiratory distress syndrome. Option B, lung abscess and sepsis. Option C, respiratory failure. Or is it option D, all of the above? 87 have answered it. 94, 96. Okay. 77 of you have got it right. Yes, it is D, all of the above. Sepsis is particularly dangerous pneumonia complication, a life-threatening condition, and it can also lead to tissue damage, organ failure, and death if left untreated. There are many complications caused by pneumonia. You can in simple learn a mnemonic called SLAP-HER. Okay, S for septicemia, L for lung abscess, A for ARDS, P parapneumonic effusions, H for hypotension, E for empyema, R for respiratory or renal failure. We've done with all the 12 questions. Congratulations to the winners. We also urge you to join us every Thursday Facebook Live at 3 p.m. for more and more exciting webinars and quizzes. Also, do take a selfie with your quiz group and post it with hashtag Yashoda Hospitals Nursing Education and Training Webinars on your social media. Make it more and more interesting. Let's see the winners who are on the podium. 3rd place, SSV. 2nd is Laka. And the 1st place, Swami. Swami is on the 1st place. Congratulations to all 3 of you. We have runner-ups in the 4th place, Mega, and 5th place, PC. Congratulations to all of you. That's it from our end. Over to you, Shanti ma'am. Thank you very much for the opportunity given.
So I think that was a very wonderful session, and with very great enthusiasm, you have hosted the show, Rosalind. Thanks for the same. And as you have, or we all requested, and we request still that, the participants should be engaging more for this live session, because again, knowledge disseminations should be there for everybody, especially for the nursing group. So thanking for the same, and until next Thursday, stay safe and goodbye.